This topic is about drug receptor. This is just an overview of the topic drug receptor interaction. So we'll see receptor concept evolved from receptor theories. Receptor concept evolved from receptor theories. There are five theories. So receptor theory. From this theory, concept of receptor evolved. Then number two, receptor occupancy theory. From what comes out? Agonist. Concept of agonist. Competitive agonist. Then the modification that the theory. Modified receptor occupancy theory. From this theory, concept of partial and intrinsic activity or spare. The number three, there is rate theory. From the rate theory, concept of affinity. Concept of affinity. The number four, there is two-state theory. From the two-state theory, concept of inverse agonist evolved. And number five is theory, induced fit theory. So these are five theories from which concept of receptor, agonist, competitive antagonist, partial agonist, affinity. Based on this concept, we have three types of drug. Number one, agonist. This concept of agonist evolved from receptor occupancy theory. So agonist may be of three types: full agonist, part agonist, and inverse agonist. So full agonist means agonist, that is evolved from receptor occupancy theory. Partial agonist from modified receptor occupancy theory. Inverse agonist from two-state theory. These three affinity and something called intrinsic activity. Affinity. The concept of affinity evolved from the rate theory. So this affinity is high for all of the three, but they differ from each other from the intrinsic activity. Activity. One here 0 to 1 and here 0 to minus 1. 0 to minus 1. So these are the number 2 antagonist. These are of two types, competitive and non-competitive. So this competitive antagonist, this concept originated from the receptor occupancy theory. Here, receptor occupancy theory. These two, whether competitive or non-competitive, they have affinity, but intrinsic activity is zero. Intrinsic activity is zero. Means they bind to receptor but do not stimulate the receptor. Number 3, we combine these two. That is agonist drug. Agonist antagonist. This type of drugs we mostly use in case of opioids. In case of opioids. So the opioids concept is agonist and antagonist. There is one example for this. Partial agonist and antagonist. Here we have a drug called buprenorphine, and here we have butorphanol. Butorphanol. Here we have butorphanol. This buprenorphine this is mu and this is P. So this is mu receptor partial agonist. This is mu receptor partial agonist. And this buprenorphine is antagonist at kappa receptor. Antagonist at kappa receptor. And the butorphanol is just a reverse to this. It is just reverse to this. This is part and antagonist at mu. So this is the overview of receptor concept or evolved from the receptor theory. We have 5 receptor theories, and these theories gave origin to different concepts, and I have combined these concepts here. Just only two terms, agonist, antagonist, and combination of this. So opioid, we have buprenorphine and butorphanol. This mu and P, that is mu, P means partial agonist, and antagonist is kappa. Butorphanol is just a reverse to this. And because of this mu antagonist, there is no respiratory depression in case of butorphanol. And this kappa gives the property. So butorphanol as per we concern with the respiratory depression. There is no respiratory depression because we block the and there is sedative action. In detail.